Hello, I'm Ron Margolis. I want to welcome you to this video on COVID and couples. I'm a psychologist in the St. Louis Behavioral Medicine Institute, and I'm also an adjunct faculty in the Department of Family and Community Medicine at St. Louis University, where I was a member of the faculty for 35 years. So I want to share some thoughts with you about COVID and couples. This is an incredibly challenging time for everyone. The stresses that are placed on our healthcare providers are enormous. And on top of that, they have the stresses of being couples living at home throughout this process. So I want to share some thoughts about this with you. It's kind of unusual, many times when I see couples in the past, they will say, we just don't have enough time together. Now it's just the opposite. Couples are telling me they have way too much time together, and that actually can be irritating for minor things which wouldn't have bothered them in the past as a couple, now get amplified. So we'll talk a little bit about those types of issues and how to deal with that. The other during this is that each of you may have different ways that you deal with the stresses of the COVID crisis here. Some of you may want to come home and want to just say, I want to just not talk about it for right now. I'd like to kind of, quote, leave it at the office. And others, you may really want to talk about what you're experiencing and share that with your partner. Either are fine. For the partner who's listening, this could be a burden as well, but part of your job is not to solve the stresses that your partner is feeling, but to be able to kind of lovingly listen and be supportive in that role. So now let me talk about a few ideas that you could consider. And this is by no means complete, and you may have your own thoughts and your own ideas, and that's great. But I just thought I'd add some. Some people like to think of this as homework because the idea is to take some of these ideas and go with them. Try to make them happen. To kind of help your couplehood. So the first one that I will talk about is really kind of maybe surprising to you, is that one way to strengthen the couplehood is to have alone time, to have an opportunity for you to be by yourself in this time when there's a lot of intensity. So that may be going for a walk by yourself, it may be reading a book quietly, it may be talking to friends, and respecting that in each other that time. On the other side is it's important that you're not avoidant of each other, that you do have time together, and then to think about how you can have that time be a positive. So for many people, taking walks together could be riding bikes together during this time. Just some of the things that will be planning meals and making meals together could be some time. For those of you who have children and have the luxury of somehow doing this, you may have an older sib, it'd be important for you to have a time away from the kids as well. So some of these times, if you can manage that, to do that. So let me just talk about intimacy. And intimacy, I'd like you to think about it quite broadly, not just in terms of sexual intercourse, but in terms of other ways of intimacy. And that can be anything from giving back rubs to each other, it can be in terms of telling your partner how you think about them and love them and care about them, and remembering to do that, because sometimes we forget. Cuddling, couples will tell me, is a great form of intimacy. So there are very different ways of dealing this. In terms of sexual activity, I think couples should talk about it, their interest, their motivation at any moment in time, and how they might want to make that special for themselves as a couple. The next thing I would mention is dates. And it may be funny to think about COVID and dates, but one way I've encouraged couples, and it says people have found this to be a helpful thing, is that they take turns, rotate once a week, and the person who is planning the date, if it's a meal, it's from appetizer to desserts, what to do after the meal, is it watching videos, playing games, whatever it is. And that makes it more of a special night, and what you can do to make it a special date. So we talk about self-care for individuals, but there is couple self-care too. So I'd like you to give some thought to that. That may be the two of you perhaps starting a book club with couples through Zoom. It may be a video couple, connecting with couples. Some people have told me they've had happy hours as a way of just keeping connected. Other things that couples mention to me for self-care is they love to watch comedies that make them laugh. They could be ones they've watched in the past and enjoyed as a couple, because humor is important during this time as well. For some couples, spirituality is an important part of who they are individually and who they are as a couple. And we wouldn't want to ignore that if that describes you all. And that may be readings that are speak to that spirituality. It may be connecting to a congregation that has an open Zoom services. It may be talking to your religious leader. So it's important not to ignore that if that's always been a part of who you are. And again, remember, you could create more items for this list, far more than perhaps that I have shared with you. Now, sometimes couples will ask me, when should they seek help? And there is no one hard and fast rule, but I thought I would just share some of the things how I typically answer to that. And then for some, it's when it becomes really hard to connect, feeling really distant from each other. Now, it's not surprising that you would have conflict or arguments, and have those throughout, whether it's COVID or not COVID. But the issue is whether they're productive. Do you two come to a resolution? Are you feeling good about having talked something through, or does the argument just continue on and never resolved? The other role that you're also playing as at this point, if you're parents, as you become teachers, you're managing your kids in a very different way. And sometimes couples will have difficulty in kind of figuring that out, and that's another time. And the last thing, if you find yourself that you're just avoiding each other, that may be a good time to think about a consult. At the St. Louis Behavioral Medicine Institute, we have clinicians who work with couples, and feel free to contact them if you think it might be helpful. They're virtual visits, and that seems to work very well. The phone number is a 314 number, 289-9411. And lastly, I want just to share a quote from the New Yorker, which I saw first on Northwestern's Family Therapy note. So here it goes. Take a break every afternoon to meet in the living room for a snack and some light screaming. Take care, everyone.